And we've got another fabulous case from Elsa this week. So this was the 13-year-old neutral male domestic short-haired cat with 2-week history of abnormal mental status, gait and posture. So let's have a look and see what the MRI showed. So if we have a look at the transverse T2 plane weighted images to start with, if we just kind of scroll through the brain, what we're really looking for is signs of asymmetry. Is there any signal alterations? Is the conformation of the brain normal, etc.? And then we obviously want to look at the cranial nerves, pituitary gland, and extracranial structures. So in this particular case, the brain looks essentially normal. However, we can see that both middle ears here are abnormal in appearance. So the middle ears should be essentially signal void because they contain air. And in this particular case, we can see that bilaterally, we have a combination of fluid and slightly lower signal soft tissue here dorsally within both middle ears and conforming to the luminal surface. The bulla walls themselves for a cat, these are slightly thickened. And we can see that comparing the inner ears that there's a degree of asymmetry with the left appearing that the lymph within the inner ear appears altered in signal, and there's some alteration in architecture of this inner ear compared to the contralateral side. We need to be a bit careful about when we're assessing the middle and inner ears because these are very small structures and there can be a lot of partial volume averaging. However, in this case, the MRI is being really well positioned, so these are absolutely symmetrical, which makes interpretation a lot easier. We compare how the pathology looks on the different sequences. We have here the T2, T2 flare, T1 pre and post contrast. So what we can see is on the flare, very nicely, this failure of suppression of the lymph within the inner ear. So as we can see on the contralateral side, this would be the normal appearance of the endo and perilymph within the inner ear structures. It's very low protein fluid, similar in composition to CSF. So on a flare sequence, we should see good suppression of the signal. So here this failure of suppression of the signal of the inner ear would be suggestive or consistent with otitis interna. We have on the post-contrast images, we can see this abnormal contrast enhancement of the soft tissue within both middle ears, but additionally we see this abnormal enhancement of the left inner ear, but also with intracranial extension we can see this abnormal meningeal enhancement along the left side of the brainstem and cerebellum adjacent to the inner ear. In this particular case, there were some additional pulse sequences acquired which are really helpful when it comes to evaluating the cranial nerves and inner and middle ears. So here we have on the left, this is a balanced turbo field echo. So this is a high signal sequence with high contrast, which is used primarily for looking at CSF structures and the inner ear. So it's great for when we want to assess the inner ear pathology. So here we can see this very high signal within the lymph and the CSF. The contrast in this type of sequence is slightly unusual, so it's T2 over T1. There's a variety of acronyms for this sequence, so it varies depending on the vendor. So some examples would be CIS for Siemens, Fiesta C for GE. So here we can see this abnormal signal on the inner ear on the left, and additionally we have, with the higher resolution, we can see that we also have this thickening of the proximal part of the left facial and vestibular cochlear nerve. Additionally, in this case, we have a high resolution 3D post-contrast image with fat saturation, and this is a fantastic sequence for assessment of cranial nerve disease. So here we can see additionally this very nice enhancement of the proximal part of the 7th and 8th cranial nerves, the meningeal enhancement, and also the abnormal enhancement of the inner and middle ear structures. The final thing that the MRI showed was something which we'll commonly see when we have facial paresis, is that we have denervation changes in the caudal part of the digastricus muscle, which is innervated by the facial nerve. So here we can see that there's its asymmetry of the Digastricus muscles, with the left smaller than the right, so we see it on multiple planes. So this particular case also had CT, which is a really nice case to illustrate the lack of sensitivity for CT for intracranial disease. So we can see very nicely on the CT the bony structures associated with the middle and inner ears. And obviously we can certainly in this case diagnose otitis media. We see very nicely on the CT the abnormal enhancement and contents to both middle ears. However, it's worth noting that we don't see any of the meningeal changes that we see very nicely on the MRI, and we don't visualise, or we can't visualise, the abnormal enhancement of the inner ear structures. So whilst the CT allows us to diagnose otitis media, in this particular case it doesn't show the otitis interna or the intracranial extension of disease. In conclusion, the MRI shows the presence of bilateral otitis media with left-sided otitis interna and intracranial extension resulting in a focal meningitis. There was abnormal contrast enhancement to the left facial and vestibular cochlear nerves, and secondary denervation changes in the caudal part of the digastricus muscle. So hopefully you found that interesting, and we'll find out the outcome of the case from Elsa later in the week.